Watch this.
They're on the front lines, and they were at the front of the line to get protection from the coronavirus. But that didn't mean all of them were in line to get a COVID shot. There's a chance that healthcare worker giving you a shot hasn't had one themselves. It's June and summer is almost here. Unless you look at the thermometer, then it feels like we're already in the middle of it. And like the annual ritual of stocking up on sunscreen, we got you covered when it comes to keeping cool. You know what's being celebrated this month? Idaho is known for it. No, not those tubers that grow on the ground, but the grapes that grow on the vine and the sweet libation they make. COVID vaccines were first available in the United States back in December, mid-December. And the first person to get one, a nurse in Long Island, New York. The first to get a COVID vaccine in Idaho, a doctor in Madison County. Seems logical since healthcare workers work on the front lines with COVID patients, and that puts them at higher risk of contracting the virus. It would be logical to think all healthcare workers would then fall in line and jump in line to get their shots. But that hasn't exactly been the case. In fact, according to a Washington Post Kaiser Family Foundation poll, only 52% of healthcare workers across the country have gotten their first dose. And more than 33% say they're not really confident that the vaccines were adequately tested. So what's the solution? For some hospitals around the country, it's a simple one. They've chosen to make them mandatory. That hasn't happened in Idaho, though, at least not yet. Katya Stepovic spoke with two of Idaho's largest healthcare facilities to ask this question: are our healthcare professionals getting the vaccine?
How can you not be vaccinated if you're a doctor or a nurse?
Dr. David Peterman, CEO of Primary Health Medical Group, says about 30% of his staff are not vaccinated.
Given that this vaccine has been given to billions of doses around the world, with very few side effects and incredibly effective, it is hard for me to understand why any healthcare worker, unless they have a medical reason, wouldn't be vaccinated.
Healthcare workers are humans too, with their own set of beliefs. But when they're the ones who are promoting getting vaccinated since it first became available, it may come as a surprise that even some of them are vaccine hesitant.
I understand there is some hesitancy among some people in the United States and healthcare workers. But it's hard for me to understand that when what we've been through is the worst epidemic any of us have ever seen.
Katie Quinn, safety officer and COVID-19 incident commander at St. Alphonsus Health Center, says about 70% of their healthcare workers are vaccinated.
So would you say you're a little bit surprised that this percentage isn't higher?
Not necessarily. I think our colleagues are really almost like a small community where you would have a percentage who actively wanted to be vaccinated the first day they could obtain it based off of the priority group they fell in. We have others, who wanted to talk to their provider and wanted to, get some more information.
Quinn says just like the general population, healthcare workers may have personal situations that make them deeply consider getting vaccinated.
We have pregnant colleagues or colleagues with health conditions where they really are working with their provider to understand what the best course for them in regards to the COVID vaccine.
Both Peterman and Quinn agree that the best approach to getting more staff vaccinated is education for now.
It's so nuanced now, depending on the individual circumstances, which is why we're really trying to hit every piece of the puzzle of what people are thinking about.
But sooner rather than later, Peterman says making the COVID vaccine a requirement for staff could be a reality for some medical providers, including Primary Health, telling me it's more likely to happen once the FDA removes the emergency use authorization and gives vaccines full approval.
When you mandate getting a COVID vaccine for your employees, do you think you're going to lose some of them?
Yes. And I feel very strongly in that at Primary Health, decisions as relates to health care and protecting our patients, protecting our staff, We have a group of physicians who look at the evidence and then make a recommendation, and then we follow as policy. We do that with influenza vaccine, we do that with other vaccines like hepatitis, and I am prepared for us to do that with COVID vaccine, and if that means an employee wants to work somewhere else, then I support that. The obvious next step with coronavirus vaccinations is to make it a requirement of healthcare workers.
Okay, Katya, so that sounds pretty clear. Primary health, it's just more of a question of when, that they will make it a requirement for their employees to get vaccinated. But what do the other health providers across the state of Idaho say?
Well, St. Alphonsus tells me they don't want to make it a vaccine requirement for their employees until their employees and staff are ready for something like that. So right now they're still kind of in the discussion phase of everything. And I heard back from St. Luke's not long ago. They too say they're not sure exactly what they will make, the decision they will make, going forward. Brian?
Well, and it also seems like if our goal as a country is to get to 70%, but only 52% of our healthcare workers believe in it and do it, it's going to be a tough go ahead. All right, thank you very much, Katya. So where do we stand in Idaho with vaccination rates? Joe touched on this a little bit yesterday, but let's get a little deeper. Look at some other facts and data about this. You can take a look at this graph right here. This looks at weekly doses that have been delivered and administered for the month of May. The purple line there, number of doses delivered. The green, that's what's been given out. You can see we started off May, that first part of the left side of the graph, about 44,000 doses into the arms the week of May 2nd, out of the 53,000 that we received. We dropped to about 38,000 the next week. Then on May 12th, the Pfizer vaccine was opened to include those 12 years and older. And so you can see that kind of jump up a little bit when it comes to things kind of come together a little bit. That number dropped, though, to 26,000 last week, so we've seen that fall off. Then in mid-May, the state actually rejected about 60,000 doses of the vaccine because, well, we had too many on hand. Latest data showing that we have 368,000 doses available in the state of Idaho, which adds up to about 11 weeks worth of COVID-19 doses. And as of right now, nearly 40% Idahoans completely inoculated for COVID-19, which is about 8% behind the national average. Unlike our neighbors, Oregon with the $1 million lottery and Washington just announcing $250,000 a week and then an additional $1 million giveaway after those first 4 weeks, Idaho isn't really offering any kind of incentive to get the vaccine. But the Department of Health and Welfare, along with the governor's office, says it's really not out of the question. Here's some brand new information for you. Just came in, thought we'd share it with you. It's hot outside. I know, you're as shocked as we are, right? Well, then better stay with us. We got some more piping hot tips on the temperature we're going to tell you about. And while you're staying cool inside, watching the 208, we want to know what's on your mind. Got any hot takes to tell us about? Well, here's the number to text, 208-321-5614. Send us your questions and comments, and we want to hear everything. We're going to show some of the fire texts we get at the end of the show.
Yes, it is very hot, very hot. Here's the high so far, and we still have another good hour of heating that could take place. This could really get up there. 101 so far. Look at the average, 77, so we're about 25, roughly 25 degrees above the average right now. The record was 98, 2007. Boom, it's gone. So we have the heat with us today, and what's happening was it's moving over the valley, so it's right over us at this particular time. It's going to continue moving eastward, which means that we get maybe a drop of 5-6 degrees for tomorrow, but a little more relief as we get into the weekend. So these are some of the highs. Now, Mountain Home has 101 as well. Just about everybody's right up around 100 degrees. A surprising thing is Ontario at 98, but they have the clouds because of these thunderstorms that are here to the southwest. So it's probably keeping their temperature from getting above 100, but nonetheless, it's still hot. So you see all of this line of thunderstorms here, mainly in southeastern Oregon. And if you look right here around Jordan Valley and the Idaho border, you're looking at about 30 to 40, maybe even 50 miles to the west there. So they're not as close as what they might appear, but just to show you that some of these storms are breaking up as they're moving into Idaho over the Owyhees, so we'll just watch those closely, but to let you know that they are there to our south. And you can see here that later this evening, some of these spots like Owyhee, Nissa, Ontario, Weiser, some of those locations could be very close to some of those thunderstorms for this evening. So let's take a look at our high for tomorrow. It drops down to 95. Low tonight down to 68. Not a whole lot of relief, but Saturday morning's better at 61. And look at Sunday, a whole lot better with a low temperature down to 41. Temperatures next week will basically be into the 80s. And so there's about a 20-degree drop from the high temperature that we had for this afternoon. And then getting into next week, you see most of these temperatures will be into the 80s to 82 degrees by the time we get to next Thursday. So we're looking at some pretty hot temperatures that are really taking place at this particular point. And this is the temperature trend. And this is just to show you, as you look off to the side here, you can see that the temperatures do drop into the 80s for next week, Wednesday, Thursday, and Friday. But look at next Saturday and Sunday. They're back up to about 90 degrees or so, which is hot in my category, but we're looking ahead to at least getting some relief for a while, which moves into this weekend and the first part of next week.
It's still not as hot as today. Just before 3:30 this afternoon, Boise hit that triple-digit high, the second earliest that we've reached that record-setting milestone in Boise. Only once before has Boise been 100 before June 3rd, and that was way back in May of 1897. In recognition of this record heat, we want to remind you what we always seem to do this time of year. Well, not this time of year, usually much later in the season, like usually closer to actual summer. But here we are, June 3rd, and it's unusually hot. So here's your standard stay safe story for summer weather. These stories always seem to start with a shot of the sun because, after all, it's the main reason we're doing these stories. We all know it's gonna be hot. I mean, cue the customary confirming question and answer. It's gonna be hot today.
Yes, it is.
And here we go. When the temperatures keep climbing, there are two types of heat handlers. Those who try to beat it, and those who embrace it. But like this other shot of the sun you probably expected to see right about now, it's something you already knew. Still, we feel the need to, reaffirm what else you already know about keeping cool and safe in Idaho's heat. The most important thing to remember in heat like this, and I'm sure you probably heard this before, hydration. According to the Mayo Clinic, a man would have to drink 4 liters of water, or nearly 4 liters of water, 3.7 to be exact, to be hydrated throughout the day. Women, a little bit less, about 2.7. Still, it's a lot of water. And right now is a good time to start. Okay, so here's another thing you probably already heard. You want to try to stay cool, and that means staying away from that as much as possible. And to do that, guess what? You got to find some shade. Oh gosh, okay. Okay, so while I move this table, please enjoy another shot of the sun, and this guy getting some of it. Oh yeah, don't forget to hydrate. Okay, so you made it into the shade, but what if you have to be out in the sun? How do you protect yourself? Oh, I know, sunscreen. And they say it's gotta be broad spectrum and at least 30 SPF. They are the American Academy of Dermatology, and they say it needs to be applied every 2 hours, or after swimming and or sweating, which is pretty easy to do on a day like today. So how much should you use? Well, again, according to the American Academy of Dermatology, in order to cover all the areas that your clothes don't, you're gonna need about an ounce of sunscreen. to cover the spots where your clothes don't. I mean, it doesn't seem like a lot, but yet it kind of is. Like this guy. Don't forget, fluids. Kind of runs right through you. Okay, so I hope we help you beat the heat with these tips. Okay, who put an egg on the asphalt? Gross. Oh yeah, one more thing, and probably most important. Don't ever leave kids or pets in cars, especially on a day like today. Oh look, a cookie on the dashboard. It's like it's fresh out of the oven. So settle in, folks. We got a whole summer coming. Yeah, it could be a long, hot summer. Last time it was this hot, this early, was back in 2016. Boise hit 97 on June 5th and 101 on June 8th. That summer was the fourth hottest on record. And the Pioneer Fire, it sparked in mid-July and burned to early November, torching nearly 190,000 acres. Last year, number 7 on that list of hot summers, tied with 2018. And summer doesn't even start until June 21st. Well, if you're one of those who likes to shed your threads when it gets this hot, hopefully it isn't something you consider doing in public, at least not completely. Be warned, we're about to talk about the human body and its unclothed condition, so if that makes you a bit uncomfortable, well, you may want to mute your TV for just a minute. Over the holiday weekend, there were several reports of people trying to get some sun in places that are usually covered by clothing. The Coeur d'Alene Press laid bare the fact their readers called to complain about some women enjoying the weekend and the beaches along Lake Coeur d'Alene topless. See a topless woman, call the paper. Seems logical, I guess, but also about as clear as Idaho's indecent exposure law. Section 18, Chapter 41:16 of Idaho Code limits who can show what and, well, where. Quote, every person who willfully and lewdly either exposes his or her genitals in any public place or in any place where there is present another person or persons who are offended or annoyed, well, is guilty of a misdemeanor. Genitals, but no mention of breasts. And I think we can all agree tops aren't necessarily bottoms. But before you start thinking, sweet, going sand civvies at Quinn's Pond this weekend, well, Boise City Code, a little more clear on the subject. Title 5, Chapter 6, Section 2, nudity prohibited. It shall be unlawful for a person to knowingly and intentionally, in a public place, appear in a state of nudity. And rules have exceptions. This one includes young children and breastfeeding mothers, which was actually illegal until 2018, when the Idaho legislature unanimously passed a law allowing women to feed their infants in public. Idaho being the last state to allow such a thing, by the way. Moral of the story, we know it's hot, but keep your clothes on in public or risk paying a fine. Year-round, Idaho's known for the tasty and versatile potato, but another crop making a name in the Gem State. This one just hangs from vines instead of buried in the ground. And this month, we're celebrating the popular drink they produce. Well, it's already past 5, which you know what time that is. Time to text at 208. 208-321-5614. Before you celebrate with a glass of whatever, send us your questions and comments. Whine to us if you'd like. We want to hear all about it. Just include your name and the hashtag #the208. Telling people you're from Idaho always seems to render the same response, right? Oh, potatoes, huh? Like with every meal, or? I mean, it's not their fault. It's our state veggie. It's on our license plates, famous potatoes. And because Marilyn Monroe once wore a potato sack as a dress, well, it's what the world knows about Idaho, even though it's mostly an eastern Idaho thing. You know what's becoming more of a rest of the state kind of thing? Grapes and wineries. And since June is Idaho Wine Month, we decided to bring back this little Idaho gem. Several years ago, Mark Johnson stopped by one of the oldest and biggest wineries in the Snake River Valley region, San Chapelle, which sits atop the Sunny Slope region of southwest Idaho in Marsing.
It started up in 1975 and in the last 40 years has grown to become a nationally known award-winning winemaker. The setting is breathtaking, and so too is the size and scope of this operation, with 60 fermentation tanks at a total capacity of nearly 30,000 gallons, 3,000 tons of grape crushing capacity, and total production capabilities of 150,000 cases of wine shipped all over the country. But it's the grapes from this region that is the heart of this operation. We spent the morning with San Chapelle and Sawtooth Winery's chief winemaker, Meredith Smith. She's an Idaho native who has been making wine since receiving her viticulture certification at Washington State. She now heads up the winemaking team for Idaho's 2 biggest wineries. And she told us she loves pouring samples for visitors who come here on a tour from out of state, most with low expectations for Idaho's wine.
Most of the time what I'll notice is their eyebrows go up. They'll be like, And so I love to see that, because I know the wines are competitive, but sometimes there's a perception there that maybe they're not. And that's what, we're working on.
We ran into a couple from Washington's Wine Coast. Deborah Haggard is a wine expert and buyer and seller. And she said she couldn't wait to get here for an Idaho wine tour.
We stopped here. This is our first place. And we have 4 more places today and a couple tomorrow. And if they all go like this one did, I'm going to be a happy girl.
It is a positive sign that Idaho is quickly moving up and will someday serve California, Washington, and Oregon notice that our wine industry and homegrown products cannot be ignored. The proof is in the tasting.
The wines will show, and it's going to be the wine that's going to show that it's going to open their eyes.
All right, since we first aired that story a few years back in 2018, 15 more wineries have opened up across the state, bringing the total to 65, which is about 1,300 acres of grapes across Idaho. 2019, more than 2,100 tons of grapes were harvested, which produced more than 447,000 gallons of wine. Annually, Idaho churns out about 160,000 cases of vino, and probably not a shock, but Idahoans actually drink more wine than anyone else in the country, and it's not even close. That's according to a study by MSN earlier this year. Idahoans, we drink about 1.2 gallons of the stuff per year. Hello, Calimochos. Georgia, a distant second at only 1/4 of a gallon, and that's only a bit more than a bottle per Georgian per year. After a day like today, who couldn't use some nice fresh water rolling through the Big Wood River in the Sawtooth? So hopefully that brought you some, well, at least some sort of relief to the heat today. All right, let's take a look at some of your comments you sent in during the show, like this one from Rhonda in Boise. I 1,000% agree that a medical worker must get the vaccine. They're required to get the flu vaccine. Ignoring science is not smart and puts patients in a dangerous battle. This one from Lori, it's very disappointing to learn that medical professionals are vaccine hesitant, except true reasons that were cited. In fact, it's wrong given the support our community gave frontline workers in 2020 at the beginning of the pandemic. And Elizabeth wanted to know why we didn't ask one of those nurses or healthcare providers that didn't get the vaccine. And Elizabeth, it's not like we didn't try. They just really weren't willing to talk to us on camera. Isn't it sad that people have to be offered an incentive in order to get them to do the right thing? Well, I guess, Susan, that starts as a kid, right? You can have dessert if you finish your dinner. This weather calls for a beer with the 208, says Bill. After today, Bill, I'm ready to join you. See you tomorrow.